My name is Lynne Sinnott. I'm a family doctor. I'm a Newfoundlander, so I've been living in Newfoundland my whole life. About half of my patients are trans and gender diverse. The day-to-day of who I'm seeing for the most part is gender-affirming care for trans folks.
For the physician, it's not just a job. They're actively interested in understanding the needs of their patients and the life experiences and situations that they come into the office with, particularly marginalized, vulnerable groups. They have very complex needs that are impacted by everything from their experience in employment, in the community, the challenges they might have had with, family, friends, given a lot of the prevailing stigmas and in society still. So knowing that the physician has an awareness of those things, I think is really important.
My first visit with people is always just sort of trying to understand them and who they are and what their experience with understanding their gender identity has been, what their support system, what their life looks like, who's supporting them, who's not supporting them, how safe or unsafe their life might be, what their goals are of transition. It's so different for every single person. There's truly no one size fits all. We understand, especially in the gender diverse community, the trans and gender diverse community, is that there are those intersections of vulnerability and there's a higher proportion of social inequity. They're often not able to safely access care through traditional ways and might need different points of access. Has kind of led me to a few of the different things that I've done, including working at places like Choices for Youth.
Choices for Youth is a community organization that provides integrated youth services for young people ages 15 to 30. I think meeting people where they're at is understanding that there are a number of different models for care and that largely we work in a system that is very appointment-based, and that does not necessarily make it easy for many people who are navigating social determinants of health to access care. And so meeting people where they're at means being available when people are ready to be available.
During our drop-in, our doctors will actually come out and they will sit down and they will eat with our youth and they'll play games with our youth. Providing a community for them in their space and a safe space is something that they never got to experience. I could sit down and talk about our youth all day because they're pretty amazing. And I wish that society knew them like I know them, because they're pretty amazing. Don't listen to everything you read in the news and see in the news, because behind that news article is a person. That person is more than likely a pretty amazing person.
Community street-level drop-in clinics are a really important part of care provision, and that is where I started when I started providing care, and I think that really helped shape how I do my care now and how I provide care now. Even though it's not a street-level drop-in clinic, I still try to kind of hold on to some of those values to be able to remain as accessible as possible. I also do a fair amount of collaboration with Trans Youth NL, which is a community support organization. Having the connection to the people who are on the front line doing the work is so important, because they have a perspective that you don't. They see aspects of your patient population that you don't necessarily appreciate, and it helps give you a fuller picture of people's lives and understand them.
When we heard back in 2016 that there was a doctor who was going to be specializing in gender-affirming care, it was a very exciting moment. At the time, there really was very little information in St. John's or in Newfoundland and Labrador about how to find gender-affirming care. She didn't see her job as making her patients prove to her that they were trans. She started from a point of listening and believing her patients, and that her patients wouldn't need to go in and justify or prove themselves to her. That was a game changer. It was immediately clear that this was going to radically transform the landscape for gender-affirming care, not just in St. John's, but throughout Newfoundland and Labrador.
I service the whole province. I see people from all over the province. There's a couple of other providers that also do gender-affirming care, and so we work collaboratively where we can.
Dr. Sinnott and I are very fortunate in that we have a very similar approach to how we provide patient care. We had met when I was a resident and she was a medical student working at one of the tertiary care hospitals in St. John's.
I always say she was my first resident when I was a medical student working on the floors, and that's how we met.
So when I started my practice in Corner Brook, there was one person who identified as trans in my practice, and I had done some extra training in gender affirmative care during my residency. And so when I started taking care of this patient, and I was taking on some more patients to expand my practice, word gets out. And so I took on a large number of people seeking gender affirmative care. And so Dr. Sinnott was starting her practice shortly after that. She did a locum for me in my practice.
So she took vacation and I came out and covered for her. And so I saw some trans people in her practice, and that really helped, I think, boost my confidence about like, okay, I can provide this, and I can provide this within my family medicine practice because Amy's already doing this. And so Amy was my model for how it could look.
And so now she has quite a large practice in St. John's and really is the provincial expert in gender affirmative care, and probably wider than the province, to be very honest with you.
We do a lot of the education together through the Family Practice Renewal Program for family medicine, family physicians and nurse practitioners in primary care who are wanting to learn more about gender affirming care. And so we just have a lot of the same, I think, viewpoints and approaches to how do we build capacity around gender affirming care becoming understood and treated and acted upon as a routine aspect of family medicine.
There are huge numbers of people who need care, and a lot of them are willing to travel quite a distance, and they had to travel quite a distance at first. You think that I'm a 6.5-hour drive away from Dr. Sinnott, and so the space in between, they have to find care somewhere, and patients who are living in Labrador and up the Northern Peninsula, it's a challenge for a lot of patients to access care. I think virtual medicine has helped, but there are still things that need to be seen in person. And so it's a struggle throughout family medicine, but particularly when the number of providers who are available are small and quite geographically distributed.
Having to leave your friends, your community, your family, your home, just to be able to live as yourself to access medical care, that's a really daunting prospect. So it's important to be able to access that here locally. And it's interesting how that policy environment has changed just in the last decade, I guess, through folks like Dr. Sinnott and others who've been working. And there's a lot more work that needs to be done in terms of making that accessible here in the province. But it's great to see physicians playing a role in that process.
The biggest weakness we have in Newfoundland is just that we need more people who are doing the work. And I think that's why our viewpoint, Amy and I share this together, is that the answer is probably to be able to empower more family physicians to see this as their scope within their scope, because we are living proof of that, and be able to adapt their practice to support that. You learn pretty quickly that the reality of people's lives is vastly different than what you learn in the books, and you have to be able to adapt, because if you're waiting for it to look exactly as it does in the book, you're missing opportunities to help people.